Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Caleb Manscill. He's president of Vyne Medical. Welcome, Caleb.
Thank you, John. Good to be here.
Yeah, excited to dive into this discussion here at the HEMA conference. But before we get into today's topic, tell us a little bit about yourself and Vyne Medical.
Sure. I've been in the healthcare industry nearly 20 years, and I am absolutely passionate about streamlining healthcare. And I've been lucky enough in my career to be able to start by streamlining healthcare first through kind of the marketing side, moved into consulting, and then moved into developing product, first with revenue cycle management, and then moved into point solutions and then enterprise solutions. Vyne Medical recruited me in to focus on building out their suite of products that are connected, that are focused on connecting disconnected data. So a little bit about me, a little bit about Vyne Medical.
Yeah, that's awesome. Talk to me about Vyne Medical's recent acquisition of Extract Systems and kind of entrance into this HIM space. It's appropriate that we're at a HEMA. What was the thinking behind that acquisition?
Yeah, this is one we're really excited about. And it goes back to that point that I mentioned of connecting disconnected data or structuring unstructured data. And Vyne Medical really started in the revenue cycle management world, so highly focused on patient access. But one area of disconnected data that was really key to us was clinical data or lab specific, as well as HIM. And so this acquisition really helps us to broaden out what we're doing and move to the greater enterprise. So just not focused on revenue cycle management or patient access, but looking at all of the needs that enterprise or healthcare system would have when it comes to unstructured data.
Interesting. I mean, we hear so many people on our show talk about the value of data. Is that part of it, is getting access to more data? Because I wouldn't have described Vyne Medical that way, and maybe that's a misunderstanding. I think for you, it's more about automating the data for the end users, providers. Talk to me about how you view kind of data. We all know data's gold these days.
Yeah.
How do you view data and being able to help providers with their data?
Yeah, and I'll use data and documents interchangeably. Sure. And maybe that's what you're alluding to a little bit when you think about Vyne Medical. But those data are absolutely key when you think about the importance of those data to the treatment of the patient, as well as streamlining the workflow. I mean, that's where a lot of waste happens within the healthcare system, right? The more time it takes to append those data or those documents, the more time it takes for that patient to be treated. And when we're in critical situations with patients that, they have an emergent need that comes in, the more that we can streamline those data, the faster that patient can be seen, and the greater value that can be realized by that healthcare system.
Yeah, it's interesting. It's about access to the data. I heard a leader of a healthcare organization recently, like, man, I love just being able to automate the fax. It's like, it's going to help my staff so much because they hate it.
That's exactly right. And I think one of the important things about Vyne Medical is we're focused not only on getting that data faster, but also providing the source or kind of moving out from the spectrum a little bit more when it comes to voice solutions and fax solutions. So not only are we streamlining the data and the documentation that goes with it, but we're acting as the source, and that fax source and that voice source or other places where there's data that is sourcing that.
That's awesome.
Yeah.
And talk to me about the merger and kind of its broader impact on healthcare and kind of the automation market in general. I think the automation market is an interesting one because it's kind of been confused with AI and merged with whatever. I'd love to hear, how this merger is going to kind of impact the market as you see it.
Yeah, absolutely. We like to really focus on the word automation because that tells you what we're doing. We think about things from a job to be done. The job that we're solving is really automating that, right? And we do utilize AI, right?
Sure.
That's an important aspect of what we're doing. But I think that vernacular of automation really focuses on, again, decreasing waste and decreasing time so that patients can be seen more quickly.
Interesting. And, as you look at it, what will the industry and customers gain as a result of bringing, Extract Systems together with Vyne Medical?
Yeah, it again goes back to that enterprise, a more complete offering. When we look at all of the departments within a hospital or different facility types through this acquisition, we really have the ability to take care of each department and facility type. So it broadens us out, but it also deepens our AI, right? When we look at the models that are utilized across Extract and those that are being developed within Vyne Medical, it really provides that depth that is needed to more quickly and easily automate things.
So tell me, how should a healthcare organization be looking at Vyne Medical now, post-acquisition and merging of the two companies?
Yeah, I love that question because it really hits at one of the reasons we did this acquisition. And that is, we wanted to create a more spectrum solution that allowed us to meet the provider wherever they were. And so what I mean by that is different healthcare systems, their IT department may have very little bandwidth, and so they may not be able to support a solution. And we have the ability to just meet them wherever they are. So when I think about their IT bandwidth, right, sometimes they don't have the ability to support bringing on another vendor. And we have the ability to in a manner take care of all that IT for them so that we can move forward with that solution. But I also think about it from a modality standpoint. If they have greater needs, and I think about the flow of data from the source of data, thinking about voice, thinking about fax, where some of those sources of data come from. We control that. And because we control that, we have the ability to source good data and good connectivity in that whole process. So it takes away some of the owner's process of gathering and storing and curating those data.
Yeah, it's really interesting. Talk to me also about the ways these combined organizations are looking to address a really hot topic, clinician burnout. Yeah. So many that are just overwhelmed, and also improving patient outcomes. Tell me how these two companies and your work helps to alleviate those two things.
Yeah, I love this question because it really gets the heart of my why. Why I'm here at Vyne Medical, why I have the opportunity to lead it. Physician burnout is a real thing. I have friends that are physicians, and I've seen them go through the hardship of just being overly burdened with data and paper and documentation and the time they spend. When you think about the work they do and the stress they carry, and then you pile on hours every single day of documentation, it is painful. And I say that, but then I think about a friend who was married to a doctor, and this overwhelmed him so much that he ended up taking his own life. Wow. And we know that physicians have a high suicide rate. And when I think about that pain point, it's one that I feel really proud to solve. When you think about paper coming in, documents coming in, orders coming in, whether it's through fax or scan or another mechanism electronically, but it still needs to be structured, right, to the patient record or to the system so that workflows are kicked off. I feel really proud that we're able to streamline that specifically and decrease that burden on the physician.
Yeah, it is such a big problem. Do you have an example where having the right data at the right time impacted the patient outcome or improved the clinician experience?
Yeah, I think back to one of our customers who's focused on cancer care. Okay. And there was a patient, as is probably normal with this kind of care, but lots of tests, right? Lots of treatment, extended stays at the hospital, and their bill was racking up, starting to teeter over $500,000, starting to move to $1 million. And there was a point where the insurance was saying, yeah, we're denying all of this, right? Wow. And the healthcare system, on behalf of the patient, came to us and said, hey, we're getting these denials. How can you help us with this? We're like, well, from what we can see, there's a lot of unstructured data. So we were immediately able to structure that data. and they were able to resubmit and get that taken care of. Now, I say that so quickly and easily, but you have to think about the patient, right? And if they've just gone through a cancer ordeal, something that, is life-changing and hard and stressful, and then all of a sudden you put on top of them like, hey, here's $500,000 and potentially you're on the hook to pay that, right? Think about that.
Yeah. It's insane, right? I mean, I had a procedure, went to the hospital emergency room 13 months ago, and I'm still dealing with the billing from one incident, let alone cancer care, which is dozens of visits, right? I mean, like, how do you even process what billing's accurate, what's not, what bills from who?
Yep.
Yeah, that's incredibly overwhelming. And the dollar amount is probably just impossible to comprehend, right? That's so interesting.
Yep.
How about when it comes to AI and automation and their impact on financial performance, accelerating care, which I think is a big one since we don't have enough doctors out there, it seems, in many areas, and then eventually better outcomes for patients. How do you see those kind of the financial accelerating care and then of course improving the outcomes for patients?
Yeah, I'll talk about it from a patient standpoint first, if that's okay.
Okay.
And it helps me think about first. I mean, it kind of goes back to my other story, but this one hits even closer to home.
Okay.
I had a close family member who had an emergent case, a cardiology issue that came out, and he went to go in for a stent and failed that, which meant you moved to essentially open heart surgery at that point. And they thought it was just going to be a triple bypass. And when they got in, they realized that there were 6 major arterial branches to clean out. So they call it a sixer, which I had never heard of until this family member had gone through it. And the thing that was interesting to me and that really hit me hard was just prior to this family member was planning on retiring and was so excited about it, like planning his whole life in the future, and was so excited about it. And then this event occurs, which isn't necessarily a setback, but what set him back was that all of a sudden the bills started to come in. And he was really unsure about moving from one payer to the next because he felt like there was going to be a data gap or a documentation gap, and then he would all of a sudden be on the hook, which would jeopardize his retirement. And when I heard that, and knowing this individual and the life he lived and the life that he wanted to live, to see disconnected data cause that problem just absolutely sunk me and impassioned me at the same time. Knowing that's what we get to solve for these patients, that we get to give them their life more fully.
Yeah, that's amazing. And it is such a big challenge, to be able to bridge that gap of data that happens for every organization. I'd love to hear also, I mean, we're talking about AI, automation. I love that you focus on automation because you're right, that is what AI is a tool. Automation is actually solving a problem. So I love that. Yeah. But what does it mean for hospital and health systems workforce? Because when I hear automation, or a lot of people hear automation, they think, wait, you're replacing me? Or, how do you view kind of how these technologies are going to, impact the hospital and health systems workforce?
I'll share a use case when you think about a complex lab report, when you get a full panel of a lab done, right? And to input those data, so say it didn't happen within the hospital, so that data is faxed, or that documentation is faxed to the provider, it could take upwards of 20 minutes just to take that unstructured data, to structure it. And then when you think about that process that they go through, their chances of miskeying something that is critical to the patient, whether clinically or from a revenue cycle management standpoint, is high, relatively speaking. And our solutions specifically decrease that down to potentially within seconds, down to 30 seconds. So when you think about 20 minutes, down to just a very low time level, I mean, that's absolutely huge. What that does though, so it saves them time, which if you're saving time, you're saving money. more importantly, and most importantly, it allows greater bandwidth for those individuals to focus on the patient, right? Because you look at a lot of these individuals, they're wearing multiple hats, right? They're the ones that are often picking up the phone, talking to the patient, or they're sitting at a desk talking to the patient. But if they're hyper-focused on, they're midstream into this 20-minute process, there's no way they can really focus on the patient the right way.
Yeah.
And when you think about the difference that makes I just think about my own experience as I walk up. I'm nervous about whatever procedure I'm going into. I have all these questions. I want these questions answered, right? And I go up there, and all of a sudden they're just staring at their computer or whatever they're going through. And that's a poor patient experience, and it potentially leads to a poor clinical experience too, because communication isn't there, and that's a big part of clinical care.
Yeah. You bring up an interesting point that I love to explore is around accuracy. Yeah. And it, one of the challenges we have to overcome, I think, in healthcare is we are extremely accepting of human frailty because they're humans, and we're not of technology. And yet, as you described, going through that, complex lab report, the human can screw up a lot.
Yes.
And sure, the technology probably does occasionally as well. Yeah. But it's like, for us, we want technology to be perfect, but humans, okay, that's okay. And yet we're not, is that how you guys kind of approach kind of the accuracy?
Yeah, and I love how you talked about it. In our culture of our company is failure is okay, right? Like totally fine with failure. But if you can eliminate failure, right, and focus on the most critical part of care, and I would argue that's face to face, right?
Yeah.
I had an experience where I really engaged with the American Medical Association and its president, and I remember we talked about all this automation that was happening, and she was impressed, but I could also tell she wasn't at the same time. And there came a point after somebody was again going on and on about all the automation and AI. And she just turned to the person and she said, but who's going to hold the patient's hand when you tell them they only have a few months to live?
Yeah. And
it just shocked me, right, to hear her share that story. And it made me realize you look at automation and what it can do financially and ROI and everything like that. But when you hear that, when you think about that kind of care, that's what gets us really impassioned about, what we're doing.
Yeah. So. It's interesting you say that. I've heard similar stories of a nurse going and just holding a patient's hand that's not able to talk, right? And showing that compassion and love. Yeah. But if they're spending 20 minutes doing that lab report, using your previous example, they don't have time to go do that, right? Because they're too overwhelmed. If that gets down to 30 seconds, now they can do some of those compassionate things that AI can't do that, right? Yeah. It can't show compassion that way.
Yeah, that's exactly right. And you asked about accuracy, right? The importance of it. And, I think about the importance of accuracy in that regard, like trust and confidence. And I often think about that in work processes or workflow, is where's your confidence level? Is it high? If it's high, and if you can show that and prove that, you can just put that work aside.
Yeah.
And trust what you can trust, and you can focus on, again, what's the most important thing in front of you. So
that's awesome.
Yeah.
Caleb, this was a lot of fun. I appreciate you taking time to sit down with us and talk about the acquisition of Extract Systems, merging with Vyne Medical. Love seeing the innovation and being able to solve it. That's what I hear over and over from CIOs is that, hey, we need fewer systems. So it's great that you're offering more, in one package for an organization. So thanks for sitting down with me and talking with us. Thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Caleb.
Thanks, John. Good to be here.